incredible how people from all over just join. It's unbelievable. I guess you have to mute again, or?
All right, we are live on Facebook. That is good. And I'm now going to begin the recording, if that's all right with everyone right now. All right, we are recording. Do we have our third speaker, Georg?
I can't see him right now at the screen.
Don't think Hooman is here.
Not around.
Professor Wenz, have you checked his last email to you or to us?
Yes, I answered immediately, and he answered again that he got a link. I just wrote an email again.
All right, and all of our panelists should be unmuted and everyone else should be muted currently so that we can begin.
Okay.
All right, Georg, it's yours. Take it away.
Okay, thank you, Pam. So, ladies and gentlemen, on behalf of the International Association for Spiritual Care, I welcome all of you to our first webinar on religious views on what is spiritual care in the face of COVID-19. If those of you who aren't members like to have more information about our association, its mission and vision, please go to our website. We also have a Facebook account, as you just recognized. My name is Georg Wenz. I'm from the Protestant Academy in Landau, southwestern Germany, close to the French border and about 60 miles south of Frankfurt Airport. With the conference today, we start a weekly series of 4 webinars. Each of them will concentrate on one religion and invites 3 speakers from different backgrounds within these religions. Today, we will focus on Islam, and I'm very delighted to introduce to you our speakers. From Sarajevo in Bosnia, please welcome Dr. Aid Smajic. From Berlin, Germany, Mr. Imran Sagir. And from Lombard, Illinois, USA, still missing, but hopefully he will come soon, Dr. Hooman Keshavarzi. Dr. Smajic is Associate Professor at the Chair of Religious Pedagogy and Religious Psychology at the Faculty of Islamic Studies at the University of Sarajevo. He teaches general psychology courses as well as courses on Islamic spiritual care and conflict resolution. He's author of a book on religiosity and ethnic tolerance in Bosnia and Herzegovina. And if you know, it was 25 years ago when the genocide at Srebrenica was executed. If you take into consideration that Serbian nationalists still deny the fact of this massacre, you can imagine how important a book like that of Dr. Smythe is. In addition, he published several articles and research studies dealing with Muslim contributions to psychology and psychotherapy, to Muslim religiosity, group dynamics, and interreligious tolerance. And most currently, he has been doing research on work stress among Bosnian imams and religious encounter with modern psychology. Dr. Smythe, you're very welcome. Imran Sagir is a Berlin native with cultural roots in India. He works as a communication and behavioral trainer, as well as an anti-violence and competence trainer. We met a couple of years ago when Islamic spiritual care here in Germany was in his infancy. Today, he is the managing director of the Muslim telephone counseling in Berlin. This is the first counseling hotline for Muslims in Germany and the only one which works 24 hours the whole year long. Mr. Sagir, you are very welcome.
Thank you.
So, and now from Khalil here, I just see, hi, Dr. Hooman Keshavarzi. And Dr. Keshavarzi is currently an assistant professor at Ibn Haldun University in Istanbul, Turkey. He's an adjunct faculty at Hartford Seminary, a fellow of the International Association of Islamic Psychology, and the founder and director of Khalil Center in Lombard, Illinois. This center is the largest provider of Muslim mental health care in North America and works at different places like Chicagoland, Bay Area, Los Angeles, New York, and Toronto. As you can read at the website, the center's approach emphasizes psychological reconstruction, behavioral reformation, and spiritual elevation. It utilizes faith-based approaches rooted in Islamic theological concepts, while integrating the science of psychology towards addressing social, psychological, communal, and spiritual health. We met 2 years ago at the Congress in Istanbul, and I was very impressed by the work Dr. Keshavarzi introduced to the audience. You're very welcome. Hello.
Thank you, Dr. Wenz. I'm honored to be here.
Before we start with the speakers, please let me just say a few words about our schedule of today's conference or webinar. Right after my short introduction, we will listen to the 3 speakers. The lectures will follow one another without interruption. And after that, we will have the chance to discuss the topic in small groups. For that purpose, the groups are set up by random. And after 50 minutes, the groups will end automatically and we will return to the plenary. If you like to address a question to the speakers, the last plenary is the right place for it. In order to do this technically, I would like to ask you to name someone in your small group who will write down open questions and send them around immediately after returning to the plenary while using the chat function. It's not possible to use the chat function within the small group or during the small group. My colleague Yasin Harim and I then quickly will go through the chat and collect your notes. Before we start now with the speakers, I just want to mention, and Pam already did it, that the webinar will be recorded to the cloud except of the small groups. Now, ladies and gentlemen, it's time to move to the topic. Coronavirus still threatens large parts of the world. When government started the lockdowns, it affected worship services and prayers as well as daily work of pastoral and spiritual care. Churches and mosques were closed for religious services. Chaplains were not allowed to enter hospitals or prisons. Passover, Easter celebrations, and Ramadan Bayram could not be celebrated as usual. Rome, for example, was as empty as probably never before in history. But within the crisis, the religions developed new creative ways to ensure religious life. And waves of charity and solidarity impressively showed that community is not just a concept. If we have a look to Islam, then we can see that health is a high asset and that there are even specific instructions for a pandemic situation. So on the one hand, the lockdowns could easily be brought in line with Islamic requirements, but on the other hand, it led to massive loss of donations, for example, during Ramadan. Many mosques here in Germany generate around 50% of their annual income in Ramadan. This cannot be offset by online donations. And there is a third point, spiritual care. And this is what we want to talk about now. And I'm pleased to ask Dr. Smajic to speak up first. Dr. Smajic, the floor is yours. Thank you.
Thank you very much, Professor Wenz, for your warm introduction and welcome. It is a pleasure to be part of the group, and it is a great honor to present today. Given the overall title of the meeting, our webinar meeting today, I entitled my presentation Muslim Spiritual Care in the Time of COVID-19 from Bosnian, so to say, Bosnian perspective. Definitely this topic is, I would say, demanding one, and it will usually take me more than 15 minutes, to answer all questions or themes and topics I possibly would like to touch upon within this presentation. However, due to this limitation of 15 minutes, basically I'm going to try to answer 5, so to say, W's. Okay. In sense to answer the question, who provides what kind of spiritual care to whom, for what issues, and in which ways in the time of COVID-19 in Bosnia and Herzegovina. For Muslims, of course. Here I'm talking first and foremost from the perspective of Bosnian Muslims or ethnic Bosniak. So within these 15 minutes, I'll try basically to answer these 5 W's, 5 questions. That is to look who basically today or in last 2-3 months has been responsible for providing spiritual care to Bosnian Muslims. What usually here from, so to say, Bosnian Muslim perspective we have in mind when we say spiritual care activities in general sense. What are consumers of what category of people are usually consumers or have been usually consumers of spiritual care in last 2-3 months, that is during the COVID situation. For what issues or questions, difficulties, types, so to say, of stress they contacted spiritual care providers, and in which ways they try to, to reply, to provide back, so to say, spiritual care to Bosnian Muslim consumers. However, answering these, so to say, 5 questions, or when answering these 5 questions, we should have in mind certain remarks or certain context, which are entitled here introductory remarks. Okay, in that sense, we should know that the main Muslim religious organization in Bosnia for last, let us say, more than a century has been Islamic Community in Bosnia and Herzegovina. As such, Islamic Community is very, has a long history, more than 1 century, and also it is globally present, so to say. That is why you have, for example, representatives of this Islamic community in Bosnia and Herzegovina throughout almost the world, from United States to Germany, even Australia, and many other countries in the world. Okay, so in that sense, it is very traditional. has a long history and very organized religious organization. Okay. Secondly, when talking about consumers of, let us say, Muslim spiritual care in Bosnia today, we have to have in mind that Bosnian Muslims, that is ethnic Bosniaks, have a recent history of war trauma. War trauma they survived in early 90s. I have to underline this issue because when dealing with the people, when providing spiritual care to believers during COVID, very often we have to deal with the difficulties, concerns, traumas, early traumas, which are triggered by corona situation. Okay. Third point I would like to underline here is when we talk about spiritual leaders, Muslim spiritual leaders on the ground in Bosnia, usually we refer to imams, okay, who usually, who usually work as a part, who usually work in the premise of the mosque. However, these kind of people, these, so to say, Bosnian Muslim spiritual leaders on the ground, which are usually attached, as I said, to the mosque, have very much multitasking responsibility. When we talk about Bosnian, Bosnian imam, it is not person or religious person or personality responsible for leading prayers only, but rather his responsibilities are much wider. He is at the same time, leading leading prayers in the mosque, but at the same time, he's an educator, a psychotherapist, social worker, social activist, and so on and so forth. Okay. A last point I would like to underline, or I would like you to have in mind in order to have a context within which we should, or I have to talk about Muslim spiritual care in the time of COVID in Bosnia, or from Bosnian perspective, is that irrespective of the fact that Islamic community in Bosnia and Herzegovina is very, as I said, organized structure, or a religious organization with a long history, unfortunately, we cannot say that that it managed so far to systematically develop theory and practice of spiritual care. Okay, so these are for me, or from my perspective, 4 important points we should have in mind when trying to trace spiritual care activities targeting Bosnian Muslims or Muslims in Bosnia, or Bosnian Muslims living throughout the world, or and in Bosnia. If we have to have a kind of full picture and to properly understand the context within which Bosnian Muslims are provided or given spiritual care during COVID. Okay, intentionally here I say Bosnian Muslims because intentionally here I say Bosnian Muslims living in Bosnia and throughout the world, because very often we find Bosnian Muslims, in diaspora, who are very much attached to the institutions and mosques of the Islamic community in that respective countries, for example, United States, Germany. So eventually, very often for spiritual care, they would refer to the Islamic community or representatives of Islamic community there. Without any further delay, and having these 4 points in mind, and now I would like to go straight forward to answering these 5 W's. Okay, these 5 questions. In sense, who provides? Eventually, my PowerPoint presentation would be about having or providing kind of overview of activities of the Islamic community during COVID. Okay, Why? Because when we talk about providers of spiritual care for Bosnian Muslims, basically we have to eventually say, yes, these are usually institution departments, individuals who belong or who are attached or who are part of the Islamic community in Bosnia and Herzegovina. Okay, and in my so to say very wide, I would say, or very wide understanding of spiritual care, I would say that that entire body of Islamic community should be mentioned here as somebody responsible for providing spiritual care for Bosnian Muslims, either in the country or diaspora, including different governing bodies, education institutions, specialized departments and services, and eventually mosque imams and volunteers. Okay, that is in managing or in making sure that Bosnian Muslims or ethnic Bosniaks are provided at least minimum of spiritual care during coronavirus. Basically, entire structure of the Islamic community has to be engaged, including, as I said, governing bodies of this Islamic community, but also education institutions, very small and very recently established specialized departments for marriage and family and counseling, and eventually mosque imams and volunteers who on the ground basically provided or were responsible for provided direct spiritual care to Muslim believers in Bosnia and diaspora. Then going to the second point, what, so to say, general activities here we have in mind when we talk about providing spiritual care for Bosnian Muslims, either they're living in Bosnia or some other countries. The starting point for me basically was what we call in Islam maqasid al-Sharia, or 5 essentials of human well-being in Islam or Sharia, which should be protected and taken care of. Okay. In other words, in Islamic understanding of well-being and taking care of human well-being, basically we should always try to protect with our activities these 5, so to say, values, 5 values or 5 essentials in Islam. Okay. Accordingly, many of activities of the Islamic community in Bosnia and Herzegovina exactly were targeting in the context of providing spiritual care, have been targeting preserving these 5 values of human well-being in Islam and Sharia. Okay. From the very beginning, for example, Islamic community in Bosnia and Herzegovina has been very cooperative in regard to public authorities in implementing all instructions provided by them. I'm underlining this point because I do not know what happened in your region, but here very often we have, I would say, these were individuals belonging to specific or certain religious communities who simply did not care or didn't want to care about epidemiological instructions provided by public authorities, public health authorities. Okay, that is why I underline very much cooperative attitude of the Islamic community and its authorities in this regard. So when talking about general activities conducted as a part of spiritual care, and given having in mind this so to say framework, I also would mention a need to reorganize religious activities in the light of new circumstances, including daily prayers, Quran recitation, and yes, Ramadan activities. As you are probably aware, all Corona or COVID-19 issue and situation came to us during Ramadan. So the Islamic community, like many other, I believe, Muslim communities in the world, had to reorganize Ramadan activities as well. In addition to this, I also would like to mention humanitarian activities conducted representatives of the Islamic community in Bosnia and Herzegovina, in sense that Islamic community and its representatives recognized people in the need and tried to provide this, in addition, has been very present in the efforts of the Islamic community during coronavirus, in sense that it had to continue with its education activities concerning religion, religious values, and so forth. But under new circumstances, and accordingly, it had to reorganize these activities. Eventually, yes, we come to the point about which we are very, I believe, we are the most interested in, that is specific spiritual care activities, including regular counsel services and newly established counsel services. That is, as I underlined at the very beginning, we cannot say that the Islamic community in Bosnia and Herzegovina has developed system, has managed to develop very clear and precise and systematic service of providing spiritual care. Okay, accordingly, efforts of the Islamic community in that sense has been very limited. That is one thing we have to have in mind. Why? Because the history and tradition of providing systematic spiritual care is very limited, has been very limited, and is still, I would say, at the very beginning of its development. One of the things Islamic community undertook at the very beginning of corona situation is establishing new counseling services. I know for certain, for example, that, for example, in Germany, representatives of the Islamic community in Bosnia and Herzegovina, they initiated or opened a counseling service, telephone counseling service for Bosnian Muslims in this country, who are usually users or consumers, or who have been usual consumers of spiritual care in different forms provided by Islamic community during coronavirus. If we say all Muslims or all Bosnian Muslims identifying with the Islamic community, I would say this is wrong. Why? Because we have instances and examples of even non-Muslims referring to the representatives counseling services of Islamic community in Bosnia and Herzegovina for some kind of support, psychological support, and help. However, with more certainty, we can say that the spiritual support has been usually asked by vulnerable categories of Bosnian Muslims or Muslims in Bosnia, including parents who very much were worried about the way they are going to help out their children, given new circumstances in education, how we are going to all education system has been working now, and so on and so forth. Then elderly. Very much vulnerable category in a case of Bosnian Muslims during COVID has been elderly people, and accordingly, Islamic community using its resources used very using its resources very much targeted elderly population.
Just one interruption, please. You have 3 minutes left, please.
Okay, thank you. Then individuals with the early history of psychological and family difficulties okay, which is, I believe, very important point here. Why? Because we have people who are whose difficulties are related to coronavirus as such, and on one side. On the other side, there have people, you know, who have a history of earlier traumas, earlier psychological problems and issues, which has been or have been triggered by corona. Okay, and we have few instances of even spiritual care providers who ask for some kind of support. What issues? For what issues these different people or people belonging to these vulnerable categories usually referred for for spiritual support? Some, as I said, psychological distress and difficulties have been caused specifically by COVID-19. Okay, some others on the other side have been referring basically to earlier stresses and traumas which have been reactivated by corona. Eventually, when coming to the ways or different methods and techniques we use to provide spiritual support to these vulnerable categories, or all people who ask for some kind of support, spiritual support, basically we usually refer to standard ones. You know, when we have you know, depending on the kind of problem we are suffering, or we have people suffering with different kinds of problem, and accordingly we always basically use some kind of standard methods and techniques used by psychologists and psychological situation of this type. Okay, in addition to what I would call religious, so to say, methods and techniques. However, the extent and the nature of this, so to say, religious methods depend very much on appraisal of individual religious and spiritual inclinations and perceptions of client, also on the previous formal education of the care provider, and eventually on the creativity of the care provider. Eventually, as we are fully aware, providing spiritual support might be a science, but also a kind of art. And very often in this providing spiritual care, different people who have been practicing this on the ground and being in position to provide directly to spiritual support to others, very often would use what we probably can call Islamic behavior cognitive therapy, in sense that in their care they combined different rituals and supplications, recitation of Quran on one side, and on the other side, cognitive restructuring using different Islamic texts and notions mentioned here in the slide. Basically, this would be all for time being. Thank you very much for your attention. I believe much more we can discuss later on. Thank you.
Thank you very much. Maybe you can hear the virtual applause. It's only in our ears, but be sure the people would do that. We continue directly with Mr. Sagir from Berlin, and I just move to you, please.
Thank you very much. I'm very honored to be with you and to try to present you in English what I have to share with you. But I have to mention that English is just a cricket language for me, because I'm very interested in cricket, and that's the language of cricket, and it's very limited. Maybe to explain everything very properly what I want to mention and share with you. Just a minute. Yes, so here. I want you to introduce our service helpline. which we have for the people here in Germany. And then we will have focus on the experiences we had at the helpline with COVID-19. First of all, I want to mention that it is a project which is promoted by Islamic Relief. It's an help organization which is also based in Germany, but it has also sister organizations in other countries. And we're cooperating with the Diakonia here in Berlin and Brandenburg, Schleswig-Oberlausitz, and also with the Caritas itself. And we have a cooperation with the spiritual care and counseling helpline of the churches here in Berlin, Brandenburg. So it is a service for Muslims, for all the people here in Germany, especially for Muslims, and also in cooperation with the churches, social organizations. As you know, spiritual care in telephone counseling, it is a very general service. You can contact us with all the topics you can imagine in life, but especially these topics which I have mentioned here at the sheet here. It is especially sadness, loneliness, despair, anxiety, hopelessness, pressure, lack of prospects, and maybe also suicidal thoughts. But a thing which we are recognizing is that depression is becoming a topic which is mentioned very often, and we have to recognize that this is maybe a trend in society that we have to be aware of. In the 10 years, or maybe nowadays 11 years of our existence, we've received more than 51,000 calls, and it is a trend that even though telephone is not maybe the modern service we can offer, but it is the service which is highly recognized by the people, and also they trust in this type of service, because it is a service which is existing in Germany since 60 years now, or more than 60 years now, and the Muslim Counseling Helpline is just another part of it. And so the society knows the Telefonseelsorge, which is called in German. So that's why we have the high acceptance also in the Muslim community, even though it is a new service to the Muslim society here in Germany. How do we help the people? We listen and lessen the burden of the caller. We found solutions for the crisis together and not for them, that we are talking with them on not an expert and client situation, but we want to be like people's on the same stage of expertise. We encourage and strengthen the caller with our support, that they have more courage to tackle their situation in which they are. We counsel and recommend professional institutions if needed. I mean, telephone counseling has also its very clear limitations. We lessen the burden and so on, but we can't help practically. So that's why if there is needed more expertise, like medical or in other fields like depth and so on, so they have the opportunities to get the context from us, and then they can try to get the help from there, which they need more than the counseling we offer. We protect also the anonymity of the caller, but it's both-sided anonymity, that they also don't know to which specific person they are speaking to. We fight loneliness and create an easy atmosphere, that they have the opportunity to talk about their problems where they are not able to talk, people which they know in their environment themselves. We have understanding for the situation the caller is in. We create an atmosphere that they don't hesitate to share the problem and the feelings they have, and then they're more able to express themselves. And this is the main purpose, to have an anonymous space at the telephone with us. And also, what is really important is to mention that we are not a fatwa hotline or a psychological helpline. They have the opportunity to share with us, but we are not giving answers to them or giving them a cure. Okay, we are the first step maybe on this way to have a cure or to have answers to specific questions, but the main target is to give them the encouragement to go their way and to have the solutions they need, but not to have the solutions from us. Principles of our work, obviously, there's the understanding. We have the understanding for each and every caller. We do not judge them, and we are not the one, as I mentioned, that we receive them as clients, and we are the experts. This is the not the setting in which we are working. We are working on the same level as the caller, and we have to try to give them the courage to go on. Everybody is allowed to call us, Muslim, non-Muslim, male, female, old, young, and so on. So if we have a call, so that we don't know who is calling us, and also we demonstrated in the case of our greeting which we are using, we don't greet by ourselves. We wait how and in which phrase, with which phrase the caller is greeting us, and we greet them back with the same phrase as they used. Normally, when you have a Muslim counseling helpline, maybe you expect that we'll greet with Assalamu alaikum, but we are very clear about that, that maybe there is a person who is not Muslim, and maybe it is also somehow not so welcoming phrase for the people, and maybe it's also a Muslim person who is not so close to religion, and maybe it is offensive for them. So that's why we are very clear about that we have to be careful to use religious phrases. But if in the call we have the recognition that Islam is maybe a source for the calling person, and then we use it as a source to give them the encouragement which the person needs. We respect the Islamic framework, obviously, even though we are not a helpline or a hotline to have Islamic informations, but we maybe pray for them all the time, but maybe we pray also with them if there is a person who is in a really need of an encouragement, also spiritually, and there is a link to religion itself. So we have our service generally in German, but on Tuesdays we have service bilingual in German, also in Turkish, but also other languages are offered, but the caller has to ask when at which time a volunteer is there to give the service in the language he wants. As I mentioned, anonymity is a very special and a very important point and for our service, because the anonymity guarantees that the person who is calling is not under pressure of moral connection to the counseling offering person. So this is a thing which we have to respect very strictly. And the other thing is that we don't give any information about the calls to people outside the service, even though for our trainings and our supervisions, we are using some cases to understand and to cope with the pressure we have as volunteers. But normally outside the service, we are just using some examples which are anonymized to explain what we are working on and which cases we have to face to make the people understand what Muslim counseling helpline is all about. But normally it is closed and it's not allowed for the volunteers to talk with their friends or with their family about the service, what is going on here. We are 24 hours daily available, including holidays and Sundays. Yes, we are working with volunteers. Sometimes somebody is ill and we can't exchange the shifts. So somehow there are some hours which we are not available, but normally we are 24 hours daily available. It is a professional volunteer service. We don't pay them, but they get a good training before they start to work with us. It is a 6-month training. We have standards on which we also respecting as a service, but also as individuals. We have supervisions every month where everybody who is working with us as a volunteer has to be there at this working group to have the supervision with experts. And also we have the call for the volunteers themselves. If they have some problems in their private life, for example, or their professional life, so they have the opportunity to have meetings with us if they want to. And it is free of charge for the callers. Obviously, we have the our service is also financed since 2016 from the government here in Berlin, from the state of Berlin. But most of the expenses are also provided by our umbrella organization or promoting organization, Islamic Relief. The religious character of the helpline is that it is a religious motivation to provide the service, and also for the people who are volunteers with us. It has focus on the case of the callers. If religious and spiritual topics are identified as resources for the people who are calling us, so it is used by us to give them the support and encouragement which they need. It is a service which acts on the principles of pastoral care and counseling, and it is easier for the Muslim community to call us because they identify themselves with the name of the Muslim counseling helpline and the organization Islamic Relief, because it's well known here in Germany. We have also other 3 projects in which we are involved. We have pastoral care and crisis situations, the so-called Notfallseelsorge in Germany. If, for example, there are accidents or case of death and catastrophes, in cooperation with other partners and the authorities, we provide pastoral care at the spots, or also at the homes of the affected peoples or the relatives of the affected people. We have also chaplain services in jails with other organizations together here in Berlin. And we have also a training for volunteers in pastoral care and hospitals here in Berlin, even though they are not started with their service at the hospitals. Now we focus on the COVID-19 and the helpline. We had, first of all, organizational challenges because we had to see how can we provide our service further away because of the circumstances we had. But Alhamdulillah, we had a good chance to provide our service further, because we had the even though we had not such a strict lockdown here in Berlin, but if it would have been the case, we had the opportunity to have a letter of our organization, and it was clear that the telephone counseling helplines, not just ours, also the others, they would have the permission to go to the office and offer their service, because it is not allowed to have the service from at home normally. Even though it was also in discussion whether it would be an opportunity to solve the situation. Peak of the calls linked to COVID-19 was from mid and end of March till mid of April. Normally we had the expectation that there would be a huge number of calls linked to COVID-19. We had an increase of 50% more calls than in other times since the COVID-19 crisis has appeared, but directly connected calls were just 100 calls. Just to mention that we have about 450 to 500 calls a month. It is a very, very small figure. I'll come back to the point maybe why there was not such a huge number of.
Just 2 minutes left.
Okay, yeah, COVID-19 calls, but the topics in this calls directly connected to COVID-19, they were concerned about family, also family abroad, or they were on travel. For example, my wife was also in India at the time when COVID-19 appeared, so it was also a concern for me myself, but even though I was not calling the helpline. This was the concern of many people here in the helpline. Obviously, fear of losing the job was a topic all in society and also here in the helpline, and family problems like they were more at home, so they had maybe recognized that there are many problems which they avoid in normal times, and now they occurred as direct or specific and very important topics for them. Now I have some assumptions why the numbers was so low of the directly connected calls to COVID-19. Most of the people were not taking it seriously in the Muslim community in Germany, maybe because of the low numbers of affected people in Germany, especially death cases. We had the luck that in Germany it was not such big the number of deaths and of the affected people. So that's why maybe the people were not taking it so seriously. The other reason, which is also maybe there, is that they were not so anxious about the COVID-19 virus, that because of the good health system we have here in Germany, and the management of the crisis was also very good. Sorry, there is a mistake. We have also a very quick reactions, especially in Berlin, about the economical policies for the people, that they didn't have such a fear of lacking of finance and so on, even though there were many problems left, but the people had a trust that they won't be so affected also on an economical basis. It is a low number and maybe a low effect, but it has to be mentioned that people were not caring because of conspiracy theories. This is an effect of the fake internet information. I think we have this globally, this phenomenon, but I have to mention it just to be fair. And then I think mid of Ramadan was also a factor. Mid of April, Ramadan started, and I can tell you that many families I know and many people I know in the Muslim community, they had a very calm Ramadan, and they, even though they were missing the prayers at the mosque and so on, it was very good to have the family all together. And maybe there were then two effects. That one effect was that they maybe forgotten the circumstances in the outside because of the COVID-19, and the other thing was that maybe they had no chance to call because they were not alone to call. So maybe this is also an assumption we have to make here, and this are the experiences we had in the 2 months which were mostly affected, and nowadays we have some other topics more than COVID-19, as I mentioned. But we have to mention the last point is that in comparison to the whole of society, it was really less the numbers of calls here at the Muslim Counseling Helpline. Our colleagues from the churches helpline, they had very high numbers of callers with linked to COVID-19, so they provided an extra helpline for COVID-19 itself here in Berlin. Now, okay, it is not so in use or in service now, because the numbers are now getting very low. But at the peak point, they had 60 to 70% calls linked to COVID-19, and they have much more calls a day than we have. They have about 50 calls per day, and as I mentioned, at our service helpline, there are 15 to 20 a day. Thank you very much for your attention.
Thank you so much. So let me just, okay, I'm sorry. Dr. Keshavarzi, please. We are 5 minutes.
Bismillahir Rahmanir Rahim. Alhamdulillahi wahda wa salatu wa salamu ala man la nabiyya ba'da. I'm just going to go ahead and share my screen. How much time do I have, by the way, just so I can pace myself? I think you're muted, Dr. Wenz.
You have 15 minutes like the others. Thank you.
Okay, great. Can you see my screen okay? I feel like this is a standard greeting now. Can you hear me okay? See me okay?
Perfect, perfect.
Okay. All right. And so, yeah, I'm honored and happy to be here with you all today, and I really appreciate the inclusion of Muslims and Islam in this topic. I think as, you know, faithful individuals coming from different faith traditions, we are really looking to serve as a support to the creation of God. And we feel ourselves as responsible to serve his creation and by virtue of doing so, by serving God. And so I think we can find a common platform where we are really working in our own respective communities and denominational approaches, trying to serve individuals that are going through immense difficulties during this time. I'll speak a little bit about Khalil Center at the end, but just suffice it to say at this point that we are the largest provider of Muslim mental health services across the country in North America. We serve upwards of up to 10,000 Muslim patients in face-to-face clinical intervention, through annually. And we have about 40,000 people whom we serve in our educational workshops and seminars that we do throughout the country. We are in 5 cities, California, and Northern and Southern California, Chicago, New York, and also over the border north of us to Toronto, Canada. And where Dr. Wenz and I met in Istanbul, I'm also faculty at Ibn Haldun University, and we also have a relationship with our institute in Ibn Haldun University in Istanbul as well. So, the thing that I want to mention is that at our center, given that we have a huge population that we serve, we also get to do a lot of cool studies, and we also get to track some data. One thing that I will note, especially in our Chicago office, and we're seeing this surge in other offices as well, similar to, I believe, many counseling centers, we've seen kind of a decline when things shut down. So our patients went virtual and everybody was kind of staying indoors. And I think there was a fear of physical safety and threat of getting sick. Then we transitioned from there into the mental health pandemic has really kicked in. And we have more patients than we could keep up with, despite the fact that our offices are still closed. So unlike Germany, that's done a very good job in keeping things together in the with regard to the COVID. The Americans have not been able to do, I can't even say a similar job because they're on different scales. They can't even be measured altogether, right? I mean, we have not even gotten past the first wave. The wave has just gotten worse and worse as we're going, and we're now looking at flatlining altogether. So it's a kind of pretty concerning state that we're in, but people are staying indoors, people are virtual, and we're seeing a mental health pandemic now following as well. And we have more people asking for services than we have providers. We've closed our offices, and despite that, on the virtual platforms, we are at 200% what we were before before the COVID started altogether. And I'm kind of hustling to try to find practitioners to help us really manage the load, and it's really getting challenging. Now, I want to highlight a couple of things, and this brings me to my work in faith and Islam and psychotherapy. That's really what I want to focus on, is that there's two things that I want to, there's something I want to show here, which is very interesting. People before, so obviously after the COVID, mental health pandemics are going high. Those that have pre-existing conditions, mental health conditions, have been exacerbated. But those that did not, we want to look at this continuum of mental health, right? The thing is that in the US, at least, we can see that after the COVID, according to University of Chicago, 14% of Americans report that they're happy and satisfied with life. But I want to draw your attention to that which I highlighted in red, and that is before the COVID, even before threat, we were at 31%. And we're not doing very well overall in just life satisfaction. Now, what I'm trying to draw, what I'm trying to say here is that there's a continuum of mental health, and the pandemic has really just exacerbated that which was already pretty wrong, I think, right? And we have one of the things that is associated with the poor mental health is materialism, by the way. Individuals that believe in materialism, right, that subscribe to materialistic values are more likely to have psychological problems and less resilient. Okay, and we see this among adolescents. And if we look at the COVID, what has the COVID done for us? The COVID has constricted more materials that we have access to, going out, engaging in the things that we normally engage in. It's forcing us into isolation. And in some of my cases, I'm seeing some of our clients, the stuff they were ignoring and distracted from are coming to the surface, right? I could just go to work, forget about it, even my marital problems, all these issues. But now that we're forced to stay indoors, I'm forced to stay alone with myself or with my family and to face my, cobwebs in the closet that I didn't want to face before. And we're seeing a huge relationship between developing a meaningful lifestyle, right? Philosophy as a decreasing kind of goal in American society. I can speak for the US because I live here. I'm from North America. So I can't speak to maybe how others are doing outside of it. But we are also seeing an increase in the value of materialism and being financially well off as sort of the goal of an essential of life. So now turning over to saying, well, religion offers a great resource for coping with mental health distress, and it forces you to sort of think about things beyond yourself, right? Having to go back and have that conversation and think about what is the purpose and function of your life, given that the world seems like a increasingly unpleasant place to live in. So what meaning can we make out of suffering, really, right? And I want to show us that the Islamic intellectual heritage is very rich in being able to help provide and shed some light on this topic. I'm just putting this up here just for a visual to show that there is a long tradition of the role of mental health and faith within the Islamic tradition and Islamic history that goes back to the Prophet Muhammad sallallahu alaihi wasallam himself. And if we look at even the early hospitals, by the way, were faith-based hospitals, though they subscribed and gave space to the importance of scripture and faith and rational and science together, right, in these places and spaces. And we see the Bimaristan systems as early as the 9th century. By the way, I use techniques from a work that was written 1,000 years ago by Abu Zayd al-Balkhi, who has a work that's been translated by Dr. Malik Badri on the sustenance of the soul and on the soul and body. And in there, he talks a lot about preventative medicine, by the way, and preventing and developing resilience in communities by changing our attitudes and beliefs and perspectives on life. And he also talks about as the interventional approaches that we can employ with those who have already gotten sick. And by the way, one of our providers, Dr. Rani in the Bay Area, who's also the head of the Muslim mental health lab at Stanford University, found a 100% convergence between his diagnostic categorization of the OCD in the DSM-5 and his manuscript written 1,000 years ago. So just kind of pointing out that there's a rich legacy that exists within the Islamic intellectual heritage that has yet to be uncovered. And that's really a lot of my work. And oftentimes, historically, pre-colonialism, health used to be a communal structure and less institutionalized. Institutions would exist, but there was also, even like in the movies, the doctor would show up at your door with the stethoscope and the black case, right? And he would show up at your door and he would come inside and you would have this communal relationship, which, I think the nuclear family and post industrialism, I think we're starting to see some of those communal supports that are evading or evaporating, and religion really provides a space for those connections to be maintained and to solidify. So then where does this bring spirituality and the role of psychotherapy? Well, if we look at, there's a huge movement, by the way, and we're not alone, right, as Muslims in this movement. And, the likes of Harold Koenig, Scott Richards, Kenneth Pargamont, we have relationships with all these individuals. And we actually have a 1-year grant from Templeton where we did this big process outcome study where they looked at all different denominational approaches to a spiritually integrated psychotherapeutic approach. And I have some data on that, by the way, but I won't share it today. So why are we making the case for religion and spirituality being a really important part of meaning making and making meaning of distress and suffering in general? Because first of all, it's the language that most Americans at least utilize when they're talking about psychological health. Religion is a central meaning making structure. People after 9/11 coped with the distress by using religion. Most people in medical treatment settings, even though they're not even coming for psychological relief, prefer and seek out alternative forms of therapy or treatment before they get medical treatment, which includes prayer, exercise, traditional healers. And here's an interesting one. 80% of a sample of mentally ill patients reported using religious coping. So we're starting to push and really make the case for we really need to get this normalized and utilized in the language of psychotherapy and in our healthcare systems. We find that 48% of patients would like their physicians to pray with them. 64% report that they would like, that they think that their physicians should pray with them if asked to do so. Now, this is very interesting, right? Because we typically don't think of our physicians, our GPs, general practitioners, as our chaplains or clergy members or pastors or rabbis or imams. But the fact that as much now when we get to mental health, we could assume that that's going to be all the more so important, right? And for Muslims, they are just like other populations that do not that are especially underrepresented in mental health care settings. Why? Because they're very reluctant to go to mainstream behavioral health care settings and treatment settings. Why? Because they want religion integrated into their mental health treatment. Now, if they have a choice, here's a study between going to an imam at the mosque or going to a secular a mainstream mental health setting, even though they know they need it, they'll go to an imam, even though they know he's not trained, okay? So then the question is, well, what would they do if a service that integrated both was available? Would they use it? Absolutely. That's what they report they want. They want professionals. They want professional mental health care because they know that the imam doesn't have that training, but they want religious integration into and spiritual integration into that mental health care. But this is really important. They want it beyond cultural sensitivity. They don't want to just go to somebody that's going to say, okay, I'm not going to shake your hand because you're of the opposite gender when you walk in. It's okay if you don't look me in the eye when we're having this conversation. I'm not going to pathologize that because I'm culturally sensitive. But they want the freedom to be able to discuss and work with religious and spiritual dilemmas in meaning making. And they want their therapists to be comfortable and fluent in being able to do that and weave that in and not be caught with like a deer in the headlights. Many of my trainees, for example, when we come in, they get the mainstream training if they didn't have any sort of religious integration in some of their schools, because in the US they have that option in some places. They'll come in and we talk about what would you do if somebody has this religious dilemma? And they're like, I don't know, am I allowed? I'll just empathize. I'll just empathize with it. I'll summarize and I'll tiptoe around it. I'm like, no, you can engage with it. Is that allowed? You know, would that be okay? Absolutely. APA has a whole division on psychology of religion and spirituality. We have books on spiritually integrated psychotherapy. And so I think it's a movement that we're headed towards, and it makes much more sense to serve the faithful communities. And so I'll just say one or two things and I'll wrap up here because I know we want to kind of, honor the time. I can be a bit radical in the, well, maybe it's not a good word to say that in the US looking the way I do, but sometimes I can be radical in my kind of approaches to interrogating mainstream behavioral health care. But what we want to recognize is that, look, when you take spiritually integrated psychotherapy or spiritual approaches, you can look at it two ways. One, you can believe in it as a secularist, as an atheist, and say, you know what, there's data to show that mental health, that spirituality and mental health works. And yes, in the broader scientific community, that's, you know, what we want to demonstrate, right? And there's proof for that. And you don't have to believe in Islam or a spirit in order to know that there's value to integrating spirituality within mental health care settings. The proof is in the pudding. You know, you can use your own methods of empiricism to prove the point. Now, but I say, as faithful people, we should not be, what do you call it, arm wrestled or coerced into having to look at it only from that perspective. Okay, I think we need to challenge and broaden the field a little bit more to say that I also believe in the spirit and its existence, even though I can't measure it scientifically, but I do believe that prayer has some intrinsic spiritual value to it, whether I can explain it scientifically or not. And I'll just give you just one show, you know, one thing here. Carl Rogers, for example, says to Paul Tillich, his mentor, I feel at times when I'm really being helpful to a client of mine, there's something approximating to an I-thou relationship between us. Then I feel as though the forces of the universe or forces are operating through me. This is Carl, by the way, Carl Rogers had disdain for integration of spirituality into mental health. Actually, some of his works speak very negatively about it, even though he was an amazing person and had a great character and made a lasting influence. In fact, I would argue he perhaps even opened the way for, you know, spiritually integrated folks to even have this conversation. But just one show, and I'll just show you this, and this is just one of a case. I'll end with a case. And so there's a woman that came to one of our providers who said for decades she had been traumatized by a toxic relationship with her mother. A woman described that one day, completely out of the blue and unprovoked or explainable by her therapy, she was overwhelmed by a feeling of complete peace. It was though I was living my mother's life through her eyes, she said, and I instantly understood exactly why she was as she was and treated me the way she did. I was flooded by an instantaneous, overpowering sense of empathy that brought an irresistible forgiveness. It was gone as soon as it came, and it took me some time with my sheikh or spiritual mentor to process it. I didn't understand what had happened, but all the hurt dissipated in that instant and has never returned. I don't know why or how I was able to forgive my mother, but I know absolutely that I did. Its effects on my psychological issues was incredible. This, by the way, fulfills the criteria of William James. It's criteria for a transcendental experience. And you know, say, I promise, last thing I'll say, and Pargamont showed in one of his studies where he took two groups of people, one that was given spiritual therapy, the other one was given mainstream secular therapy, both equally improved. Then they did a qualitative follow-up with the ones who were in secular psychotherapy, and they asked them, what changed for you? What was the moment of change for you? And the majority of them said that it was their own spiritual reflection outside of the psychotherapy that allowed them to put in perspective their suffering that gave them healing. And so this was a demonstration of the fact that whether we include it or not, people are spiritual beings, and they are wired to make meaning of their suffering through their spiritual and their cultural lenses and perspectives in which they view a pathology. So I'll stop here and we'll open the floor. Thank you very much.
Applause, I see, from everybody. Thank you, Dr. Keshavarzi. Thank you, all of you. You gave us a very good impression of how you deal with spiritual care in your different contexts. And I'm pretty sure that there is now enough to discuss, and we will break up. We now will go into the breakout rooms. And so I would like to invite you again to the small groups. And if you discuss things and you want to share some questions, just write them down and share them with a chat function. And now the groups are set, and until these are set up, use the 30 seconds to stretch, to relax your eyes, prepare a little bit for the discussion. We will see all of you in 15 minutes again.
And just as Georg said earlier, if you want to appoint a recorder for your group who will then share on the chat when we all come back together what the main questions or comments were, that would be helpful for our process as we conclude with our final discussion. So I'm going to put you all into breakout rooms right now, and we will be bringing you back automatically at the end of 15 minutes. These rooms are, sorry, I'm trying to do this efficiently, but something is not working properly here. Okay, here we go, I think. I'm trying. Trying to.
Yep.
Okay, unmute all.
I think for most of the participants, it will now be only a request that they need to confirm.
Okay, I've unmuted all, but they may not have unmuted themselves.
Yeah, they need to confirm now. It says like confirmation.
Huh.
But in the breakout rooms, they should be unmuted, I guess.
Okay. Are we in the plenary room right now?
Yes, this one here is the plenary room.
Okay, good. I wasn't sure what would happen to me. So do you need to go around to the breakout rooms and make sure they're okay?
I think I can only go to the one that you have actually assigned me to, which would be number 4.
Okay, why don't you check on that one and see
Okay.
if it's working properly?
All right, I'll do that. See you in a bit.
Hi, Yasin.
Hi. Yeah, so everything seems to be going well.
Yep, I dropped into a couple of groups and everything's fine. There's a couple of people who are either by their own choice, not in small groups. One was unassigned and I put that person in. So I think we're fine.
Yeah.
Hey, I'm just going to let the time run out and then I will bring everybody back.
Yeah, we have like 10 minutes, right?
I think so, yeah.
Great.
Okay, the people will start popping back now.
All right.
Hey, Cynthia, it's good to see you.
Good to see you too, Pam. I wish it was in Jerusalem. Yeah.
Yeah, I know. Okay.
It was very helpful.
Good.
Yes.
Okay.
Oh,
You.
miracle.
Everyone should be muted except our co-hosts,
Yes,
panelists.
they are.
Okay.
Oh. So welcome back to our final plenary. It was a little bit abrupt. So
Yeah, it's funny how that works.
In a good, deep conversation. I hope the others did the same. Yeah, we have now another 10, 15 minutes just to respond to the speakers and to report from the groups. And I just would invite you who want, I think we are so few that we can oversee and we don't have to use the chat function. So if you just raise your hand, or is it better?
No, that's fine. Whatever you want to do.
Okay,
Do you want
so if
everyone?
if just raise your hands, Yasin and I will have a look and then we call your name. So is there the first comment or question, please?
I see one hand.
Yes.
Where was it? No, I lost it again. I hear. Wim's Meet, please go ahead.
Ali?
Yeah, I'm in.
So you raise your hand.
Ali Abu Safia?
Yes.
Afterwards, we have.
You raised your hand. Do you have a
Afterwards,
question?
we have Wim's Meets.
Sorry, I can't hear very well. Can you repeat again?
You raised your hands and we just are waiting for your question.
Okay, I was asking the question during the break that, okay, during the, firstly, let me to thank you all about this session. And then my question is regarding of the healthcare professional who provide all the health care to the patient. Is there is a spiritual care is one of their responsibility to provide to the patient, or this for the chaplain or for the imam or for the sheikh or for the different, is it a different side for the spiritual for the care? You understand my point?
Yes, yes, yes. Okay, so is there the need for special trained professionals, or
Yeah, should the nurse, they have a competency, they are a competence to provide spiritual care to the patient, or this is not their responsibility?
Okay. So, Dr. Smaj, Mr. Sakir, and Keshavarzi, please, would you like to answer?
Mr. Ali, thank you very much for your question. I mean, this is very serious, very good, and one of, I mean, and at the very same, at the same time, difficult question. Should we confine spiritual care to religious personalities, or you know, or to, let us say, secular providers? To my mind, the best option and solution would be a combination of the two. We should have religious personalities who are very knowledgeable about achievements of, let us say, modern psychology, psychotherapy, and mental health. Okay, on one side. On the other side, I mean, the best situation should be if we have mental health professionals who are willing to acknowledge positive and powers, psychotherapeutic possibilities and resources of religiosity and spirituality, which is not the case always.
Okay.
Okay. So to my mind, this is the aim towards which we should somehow strive. On one side, we have religious personalities who simply refuse to accept achievements of modern psychology, psychotherapy, and mental health on one side. On the other side, very often, I personally, in my region, in a way, come across counselors, professionals who simply are not willing to acknowledge, recognize, accept possible role for religiosity and spirituality in the context of healing or, you know, helping out human suffering. I do not know whether I was clear, but you know, that is what I would like to say. Thank you.
Thank you.
Thank you so much.
Wim Smeets, you are the next one.
Okay, I'm summarizing the discussion in breakout room 2. So we had 5 questions. I will mention them briefly. So the first one is, who is helping the helpers who are very often exhausted from helping patients and families? So how deal Muslim communities with that issue? The second question has to do with referral. How do mosques deal with the topic of referral of patients, of people in need, to specialists? Are they trained to do that? The third question has to do with...
Maybe we go one by one. I guess that's easier than this. The speakers don't need to keep track of the questions.
Okay. So, yeah, Wim, is it fine?
Shall I wait now? Wait. Shall I go on with the questions or not?
I suggest we go one by one, because if I want to reply to all questions, then I have to write down. What do you think?
Okay.
It's okay.
Now, who want to reply to the first question? Who is helping the helpers? Is there a special offer at the mosques or in the Muslim community?
Maybe I can answer it for our project. I mean, in Germany, it is a standard for the spiritual caretakers, professional, or also for volunteers, that they have supervision every month or every 2 weeks to have the cases which are making a burden for them or so, to discuss them and to understand what maybe best practices are and so on. And also we have in our project, we have the caretaking for the volunteers if they have any private or professional or other problem, that they have the opportunity to come to us to discuss the problems they have at the moment. And also we have recreation together to give them a strength of the team. this is what I can share for the first question of the caretaking for the caretakers.
Thank you. I'm looking a little bit.
From Bosnian perspective, it depends on whom, or it depends on whom we are talking here. In my presentation, I try to say in a way that there are various care providers, so different profiles of spiritual care providers in a community of Bosnian Muslims, in an Islamic community. Some of them are local imams, okay? And they do not have, they are not certified spiritual care providers, and usually they do not have formal education in psychotherapy and counseling, so on and so forth. But they use their intuition, religious knowledge to help out people in the need. Who helps them? Who cares about them? I'm still doing research on work stress and burnout among imams, Bosnian imams, giving their multitasking responsibility. Okay, they are religious leaders, spiritual religious leaders on the ground in society and from community which survived genocide, which carries a lot of that emotional stuff from this period, and now we have also COVID issue and so on and so forth. So who cares about them? Usually, people, authorities of the Islamic community, okay? But yes, I would say that it would be a good question to what extent in this way and in this sense, and regard to this kind of burden, psychological burden, authorities in the Islamic community care or take care of imams on the ground. That is first point. Second point, or another group of spiritual care providers in the Islamic community are people working within recently established office for counseling. They are, yes, they are trained psychotherapists, but their work is, they start their work just a few months ago in a way. So it is, we believe that this kind of question should not or cannot be asked in their regard. Why? Because they just recently started their work. That is talking about and replying to this question from our humble Bosnian Muslim perspective.
Thank you. We have 5 minutes left. So if you go through the next 2 or 3 questions you have, Wim, maybe we can shorten the answer.
I want to be polite, so maybe other breakout rooms have also questions. So I don't want to take all the room we have left now.
I just looked through the pictures and there was no hand raised, but maybe Claudia.
I didn't see any either.
Yeah, Claudia. Pam, can you?
Claudia, you're muted.
Yes. I'm okay now. I couldn't unmute myself. It's okay now. I'm from the group 1, and we have the question: how does the COVID-19 situation influence the way spiritual care is carried out, offered, in terms of the conceptualization of spiritual care and in terms of practice? Like, that was the question of our group. That's a big question, but how does this specific situation influence the way spiritual care is conceptualized and practiced?
I can talk from Bosnian perspective, and yes, I can say COVID very much influenced the way we talked and provided spiritual care to needy, even though we are at the beginning. First of all, yes, in Islamic community, as a main Muslim organization in Bosnia, they finally were pressed or forced to think more about this kind of concerns. and provide about their responsibility to provide out this kind of help. For your information, for example, in Germany, that is, authorities in the Islamic community at the very beginning of COVID gave clear instructions to the people on the ground to provide psychological helps to believers, that is, to people in the need in general. And as reaction to this invitation or instruction, Mufti, Bosnian Mufti for Western Germany, for Western Europe, sorry, with the headquarters at Germany, immediately called in specialists to take on this responsibility. One thing, another thing, yeah, in Islamic community, COVID pushed us, like many others, to work online. Okay, that is, even though we are at the very beginning of providing spiritual care in more systematic way, at the very beginning we were pushed, I mean, in a sense that we were not able to start with it, you know, face in face, but online. And yeah, basically that was our experience with providing spiritual care. That Islamic community definitely will, from now onwards, have to consider and will more seriously consider establishing better ties with psychotherapists, professionals in the field of healthcare.
Thank you. Pam, you have the last question, please.
Well, it's kind of related to the previous, and I would especially like to get Hooman and Imran back in last question too. But Georg and I were both wondering, were there any particular theological or spiritual questions that arose in particular because of the COVID?
I can speak to that. I think there's a lot of theological questions that emerged. And this is, I think, part of the process of meaning making and trying to figure out what's going on. How do we make sense of this? One of the questions being, you know, what's the purpose of this? Trying to speculate into kind of the divine wisdom or intent. There's a need for human beings to want to know and to make meaning and to understand. And so there's a bit of speculation into that. The questions of control, how much control do I have or should I exercise and not exercise, right? Between having trust in God and versus taking means and the means of prevention in my hands. Where do you draw the line between what is appropriate fear and what is inappropriate fear? We had a lot of questions around grief and funerals, right? I mean, I'm speaking here in the US. I mean, we had in New York City, Muslim cemeteries, right? That were, you know, like numbers of people needing to be buried all at once. One of our board members lost his mother-in-law to the COVID. So some of our staff members were sick and hospitalized. And so the challenge of how do you provide grief counseling, you know, there's so many rites and religious rituals associated with A, visiting the sick, right? Or B, like burial rites, for example, and managing sickness and you know, contagion. These are a lot of the things I think, you know, we were forced to have to consider. There's just so many more. Do we close the mosques? Do we not? Is that going against having trust in God, or do we keep them open? If so, to what extent? And we're looking at previous precedents, what happened during the lives of the Prophet Muhammad, peace be upon him, and their companions. And I'm sure other faith communities are having similar debates amongst themselves, figuring out what is our communal response to provide the community. And I think one of the refreshing things I'll say, and I'll stop here, is that I saw a lot of collaboration though, between epidemiologists, bioethicists, clergy, mental health providers, emergency doctors. And that was pretty refreshing to see people come together on a platform to say, you know, we know what we know and we know what we don't know. And what do we do to inform one another on these different facets and parts of this?
Thank you very much. It's 2 o'clock at the east side of the US and 8 o'clock here in Europe, and we just made it to the point. Thank you very much again to you three for your very insightful presentations. Thank you to all of you. Very good, very live audience. So if you like, don't hesitate to register for the next webinars. The next one will be next Tuesday on Judaism, then Christianity and Buddhism. And if you are more interested in our associational work, please contact any of us board members and you will find the data on the website of the IC. So enjoy the rest of the day or evening. Stay healthy and be blessed. Goodbye. Ma'asalama.
Assalamu alaikum.
Thank you. Thank you.
Thank you all so much.
Assalamu
alaikum.
All the best.
Dania.
So Emmanuel, Claudia, Georg, stay on for just a moment. Okay, so how do we think that went? Georg, you were fabulous.
Thank you.
You did.
I was nervous.
Just great. That didn't show. You were really beautifully in charge and kept us on time. Emmanuel, you are muted.
Yeah. Still.
You're muted also. Oh, do I have to unmute you? Hold on. Okay, you're unmuted now. You should be.
No, they aren't.
Yeah,
Yes.
now I am.
Okay, sorry about that.
Yeah.
So, Georg, you were wonderful.
Absolutely.
Yeah, 3 totally different speakers.
Very different.
Wow.
We are still live, by the way, on Facebook.
Do you want to please?
Thank you. I'm going